Hello and welcome to Psyched, the show where we explore psychedelics through social, economic, and political perspectives. Graham Boyd is the co-founder and executive director of Psychedelic Science Funders Collaborative, a philanthropic group dedicated to funding psychedelic medicine and science. He founded New Approach PAC, specializing in political efforts to reform drug laws, and is the political director for Dr. Bronner's. Graham, thank you so much for joining us and welcome to Psyched.
Thank you. It's a pleasure to be here. How's everybody doing today? I'm just landing here in this chat, and I am getting oriented to the technology. So forgive me if it's a little bit uneven at the beginning, but I think I get what's going on. It looks like there are 42 participants here, which is wonderful. I'm glad to see you all. And just looking down the list of people, I see some friends there. Oh, fantastic. Well, great. Well, let's get started. I guess I want to start by just recognizing the moment we're in right now. These are clearly momentous days in our world, with both COVID-19 and this long overdue transformation in global consciousness, a growing awareness of systemic racial injustice and the disparities that permeate our culture, both in the United States and worldwide. And I'm going to be talking today about a program that the Psychedelic Science Funders Collaborative, PSFC, is doing in conjunction with MAPS, the Multidisciplinary Association for Psychedelic Studies. And I do want to just start by saying that we at PSFC and MAPS stand in solidarity with people who are collectively raising their voices to assert that Black Lives Matter. And we recognize that this is not merely a moment, but it's a sustained movement, and that we must reshape our society. And it feels important to me to open with that because I'm going to be talking about this big fundraising effort for making MDMA into a medicine. But it really would be, I think, just wrong to do that without recognizing the context that we exist in. So PSFC, I'm the co-founder of the Psychedelic Science Funders Collaborative. We're a 501c3 nonprofit. We support research on and clinical trials of physician-prescribed psychedelic medicines and patient access to those medicines. We were created in 2017 out of a realization that psychedelic medicine has the potential to make an enormous impact and has an achievable path to regulatory approval, but has been systematically underfunded. And it's our mission to fix that, to make sure that the funding is there. So I want to, let's see, I need to share my screen here. Okay. So if you're not able to see my screen, I hope one of the conveners here will interrupt and let me know, but I'm going to assume that you are. So here is an interesting way of looking at the current situation around mental health care. Suicide rates, and again, I'm going to be speaking mainly about the United States, but I think most of it can be extrapolated globally. Suicide rates in the United States have consistently been rising over the last 2 decades, even as we continue to spend more and more money on psychiatric drugs. And this comports with, I think, something that I've done focus groups on this around the United States, and can say that it's a commonly held perception that the mental health crisis is expanding, and the solutions that traditional pharmaceuticals offer are nowhere near meeting the job. And we see approval of MDMA for post-traumatic stress disorder as the tip of the spear for achieving regulatory approval for other drugs. I think there's a pathway forward for LSD, ibogaine, ayahuasca, psilocybin, and other substances. But as it happens, MDMA is furthest along in the regulatory approval path. And for a variety of reasons, I think is also probably the most easy is not the right word, but is the drug that's most likely to make it through first. And once that happens, I think it becomes easier for all the others to follow behind. So I'm going to dig in now a little bit on the MDMA protocol that MAPS is conducting. And so in phase 3, which is the final big phase of getting drug development through at the FDA or other nations' regulatory approval process, you do a double-blind placebo-controlled trial of some people getting the treatment with MDMA and other people receiving placebo. And as I'm sure most of this audience knows, the theory here is not that MDMA just automatically cures PTSD, but really it's an adjunct to psychotherapy. And so what this slide is showing is that participants have a number of psychotherapy sessions, the blue dots. And so after being screened, they have 3 sessions that are preparatory and really look a lot like regular psychotherapy for PTSD. And then there's a session in which you receive either MDMA or placebo, and then 3 more sessions of psychotherapy. And these are spread out a week between each one. So this whole course of treatment spreads out over several months of psychotherapy, and then psychotherapy with the drug, then more psychotherapy, and so forth until the end of treatment. And the phase 3 trial is broken into 2 discrete clinical trials, each with 100 participants. And so they're codenamed MAP1 and MAP2. MAP1 itself is very near completion. So most of the people have been treated. MAP2 has not yet started. So that's what comes next. And with the MAP1 study, something that's done in drug development in general is that partway through the trial itself, again, this is blinded data. So the participants and the clinicians, no one knows whether you got placebo or MDMA. But partway through the trial, there's an independent data monitoring committee that looks at the data to see basically, is this working or not? And there's a calculation of statistical significance. In other words, is the drug working at a level that we would expect or not? And the data monitoring committee can say, worst case scenario is this really isn't working, abandon the trial. The best case scenario is it's working exactly as you had hoped and predicted based on your initial research. So can carry on with the same number of subjects. Or what happens most frequently is that it's working, but not quite at the level that you had hoped. And so you have to add more subjects to increase the statistical power of the study. And they say how many more subjects to add. So this was just recently done for the MAPS protocol, and it was great news. The study is continuing unchanged, which basically means that there is a 90% or greater probability that the study will generate statistically significant results with an effect size of 0.56, which in plain English is it's really working very well. So this is great news. And what it's meant for MAPS and our partnership with MAPS is we're really moving from, if you were a for-profit company, moving from a startup phase where the funders are basically the true believers who don't yet know whether it's going to work or not. People are working usually crazy hours, a core group of true believers. You're just sprinting to try to get through it. But now we're shifting into this is real. And so we have to have the funding and the staffing to finish the clinical trials and then move into delivery of care so that all the people worldwide who can benefit from this treatment have the opportunity to do so. And that costs money. So MAPS has already, over the 34 years of its existence, has raised $70 million and has spent 53 million of that and has 23 million as cash on hand or pledges to get through basically the work that I was just showing you, the MAP1 trial and MAP2. But to finish the full FDA program, get approval from the United States, and begin rolling out CARE, another $30 million is needed. So this is just the sort of getting across the finish line concept. So we at PSFC decided to partner with MAPS to get across the finish line and created something called the Capstone Fund. And it's going to support the completion of phase 3, commercialization, meaning delivery of care, expanded access, which is where people, even during the clinical phase, will have access to this treatment, and to grow the therapist training program. So this is basically what's needed to make this real. And this is some breaking news, but this morning, Tim Ferriss released on his podcast an episode with Rick Doblin in which he interviews Rick and announces the Capstone Challenge grant. And what this is to raise the $30 million. We've already raised $10 million from PSFC members who have committed that core amount. And Tim and several other philanthropists have each committed an additional $10 million on the condition that we raise the final $10 million within the next 90 days. And so at the bottom of the screen is the URL that again went live this morning, capstone.maps.org. And I hope that you and everyone you know will go there and try to help us get through this final leg of fundraising that's needed to get this done. So I'm going to stop sharing my screen with that. And I was speaking at a rapid pace because I wanted to see if there were questions and to engage with all of you about either this MAPS program and what regulatory drug approval looks like, or the PSFC model of raising funds from philanthropists and creating a kind of community of philanthropists. Or if you want to talk about something else, we're also involved in the Oregon psilocybin campaign and some efforts to do psilocybin drug development and educational efforts in other areas. So I am going to pause there and see if there are questions.
Hey, thank you so much, Graham. Really appreciate it. I'd love to start off with, there's a lot of conversation within this space about this transition from kind of the philanthropic model to more of investment-based models of being able to push the psychedelic ecosystem forward. I was hoping you could just chat a little bit about, what are some of the problems you see on the horizon with more investors coming in, more of kind of for-profit approaches to this space, and beginning to redirect in that direction?
Well, I mean, look, at the end of the day, this space in the broadest sense needs to have for-profit activity so that it can be scaled and that everybody who could benefit will be served. I think in the near term, I mean, my tip of the spear slide that I had early on is it's kind of a cute way of saying this, but I really believe it to be true. We need to land this first effort really solidly, right? Going to the FDA or to the European authorities or anyone else and saying, hey, we're here to talk about psychedelics 5 years ago was something that would have been met with dismay. Like, who the heck are you? This is crazy stuff. These things are illegal. Mm-hmm. And so MAPS and USONA and Compass have, I think, made real progress, but really MAPS was the one who was there first, was there earliest, and were the first ones to get breakthrough therapy designation, were the first ones to get a special protocol assessment. Like, all of these sort of technical things that help lead to success were done by MAPS. And I think part of their success has been to be able to go in and say, we're just really quite sincere. We've been at this for a long time. We got the data to show it. So I'm putting a lot of effort into bringing together philanthropists to support MAPS. And I think that's where the money needs to be prioritized in the near term. And so at a minimum, I would say to anyone who's thinking about putting, $1 million into a venture capital fund or into a startup or just, something like that, it's both good business sense and I think basic ethics to also be putting a similar amount into the philanthropy to make sure that the doors really do open up so that the for-profit work can follow behind.
Mm-hmm, definitely. A lot of folks, contact me with, questions about how they can get involved. Maybe they don't necessarily have money to donate, but they want to contribute in another way. And one of our audience questions kind of extends on this as well, is where can they get involved in advancing psychedelics on the treatment level? I was hoping you could spend some time just talking about what are ways that people who are passionate about this ecosystem, who want to help the work of MAPS, the work of PSFC, be able to provide this type of care. What are some of the ways that they can get involved and be able to contribute their hours to advance this mission along?
Well, I mean, it sort of depends on exactly what your skill set is. I will say, and I'm not going to flog this too much harder, but I'm going to just put into the chat the URL for the Capstone Fund. Go there now and donate $1 or $10 or $100. Your name will appear in the little banner. Because this went live about an hour ago, you'll be one of the very first people to do that. So I really do hope that each and every one of you will go there right now and make some donation to help us move across that finish line. In terms of volunteering time and talent, certainly reach out to me at PSFC if you have expertise around communications. That's something that we're doing more of. We're also going to be working on this is sort of a technical thing, but investigator-initiated trials, or IITs, is a way to do research that is not within the main drug development protocol. And so MDMA for PTSD is being handled by MAPS. But if you want to understand specifically PTSD among veterans, or among survivors of sexual trauma, or survival at the hands of the criminal justice system, these are things that can be investigated as freestanding, much smaller trials. And so people who have expertise in clinical trial design or in working in academic centers, one of the things we are going to be doing is looking to set up IITs in partnership with universities. I mean, we're talking right now to Harvard, Yale, Stanford, University of South Carolina, and others. So that's an area. So again, it kind of depends on what your expertise is, but MAPS and PSFC are very open to volunteer help.
Mm-hmm. And let's say that, we're 10, 15 years down the road, MDMA has solidly landed. There's a lot more compounds that are going through the FDA approval process and landing solidly, opening up. How do you see the role of PSFC and MAPS, evolving over the next decade or two?
Yeah, sorry. Before I answer that, I'm just seeing in the chat that the link didn't work. So try this one, folks. This one's working for me in the chat. Yep. Good. And Libby figured it out too. Way to go, people. Team effort. There you go. So sorry, ask the question again.
Yeah, so let's say that, MDMA has a successful landing as you describe it, and 5, 10 years from now, we see a lot more compounds going through the FDA approval process, landing solidly and being able to continue to patient care. How do you see the roles of MAPS and PSFC evolving in regards to the psychedelic ecosystem over those next 10 to 20 years?
Mm-hmm. Well, I mean, we don't know is the honest answer. Part of what PSFC is doing well, I think, is that we are very focused. And, we get a lot of requests, very, very, worthy requests for support, financial support in different areas. And our answer right now is no to all of them because of the tip of the spear. We think if we can get that MDMA for PTSD through, it opens up so many other possibilities. Our mission, as currently stated, is to remain focused on getting approval for psychedelics one at a time and delivery of care. But I think we will probably revisit that mission in the next year or so after we finish the capstone raise and really seeing how much enthusiasm there is among philanthropists to support this and consider a broader mission. So, I mean, I'd love to crowdsource this too. If folks have ideas about if there is going to be a kind of centralized funding source, philanthropy for the field, what should that look like? What should it include? I don't want to pretend that I have the answers to that. I think it's something that we need to figure out. I will say, though, that on the sort of for-profit, nonprofit thing, this is a conversation that I'm sure many of you have already, been in, but it's tricky to figure out what the for-profit model looks like if you're coming from the models of either cannabis or traditional pharmaceutical. So I don't think either one quite fits. The traditional cannabis model is really one about a consumer product that you can. It's closer to sort of the alcohol model that you can go and buy it, and so the production side and the retail side of it, there's money to be made there. Probably not as much as people initially thought, but there's definitely money to be made there. I don't think that I don't see the future as being one where there are psilocybin stores where everybody can go and just buy piles of psilocybin and go and do whatever they want to with it. I mean, I know some people do think that that's the future. I'm not one of those people. But then the pharmaceutical model is really one that's premised mainly on protection of intellectual property. You develop a novel molecule, you have exclusive rights over it for a period of time, and you can charge a price that's much higher than it actually costs you to produce that molecule. But for molecules that have been in the public domain for a long time, it doesn't quite work, and I think creates the possibility of people trying to kind of gin up a intellectual property argument that doesn't quite make sense, and ends up antagonizing a lot of other people too, saying like, basically you're taking something that's in the public domain and trying to then take it for yourself, even though you didn't do anything to discover it in the first place. And so that's a very simplified way of explaining, but so the place that I think there is clearly a for-profit role is around the delivery of care, the creation of clinics and so forth. But I think the drug development itself, it remains to be seen whether the for-profit model will make sense for ibogaine or LSD or any of the other psychedelics, or whether MAPS or someone like MAPS should remain the place that actually does the drug development in the way that they're doing for MDMA. So anyway, that was a totally long-winded answer to a fairly simple question, but
no, that was great. That was really great and important. I was also wondering if you could enlighten us in regards to, you've seen a lot of the different nonprofits in this space. You've worked closely with MAPS and their mission, and this kind of extends on the conversation of how PSFC and MAPS will evolve. But what are some of the, what are some of the things you think are missing from the nonprofit landscape right now? What are organizations you would love to see spring up over these next 10 years that can really address very specific problems that you find in the psychedelics ecosystem?
That's a great question too. Well, I mean, one area is around, I guess I'll just call it politics. And there's a question in the Q&A about just legality in general and why are these drugs illegal? And so this is, I'll kind of put on a different hat here, but one of the things that I do apart from PSFC is I run ballot initiative campaigns, and I've organized and run many of the campaigns to legalize cannabis in the United States, and was involved in Uruguay and playing a little bit of a role in New Zealand right now. And I think there is a future to come around changing the laws for psychedelics. The easiest and most obvious thing is to decriminalize, and I think we should decriminalize all drugs, not just psychedelics. There's no good argument for arresting someone or threatening to arrest somebody for possession of a small amount of any drug. There's no social good that comes from that. So I think we do need more nonprofits and advocacy in general in sort of the political space. So the decriminalized nature movement, which is very localized, I think people are familiar with Denver and Oakland, but there's an effort in DC right now to have a ballot initiative there. There's one in Chicago, there in New York, it's all over the country. I think that's fantastic. And I would encourage people to check out the Decrim Nature affiliate wherever they are. And then I think beyond that, there's this need to look at what would happen if you go beyond decrim. So legalization itself on a cannabis model, I don't think is the next step to take, honestly, for psychedelics. I think that sort of as I was alluding to earlier, throwing open the barn doors and saying like, let's just let anybody buy psychedelics in any way they want to. There are arguments why that might be appropriate public policy, but to get there as a political matter, well, let's just put it this way. If we jumped right to that stage right now, I think we risk the backlash that happened in the 1960s. And I think there are public health concerns there. So psilocybin is subject to this Oregon initiative, and I would encourage everybody to check that out, which would legalize psilocybin therapeutic services. So in other words, you can't go to the mushroom store and buy mushrooms, but what you could do is find a licensed, trained, certified psilocybin guide and have a psilocybin experience under supervision. And you wouldn't need a medical diagnosis for that, but it could be for personal growth, for spiritual growth. But those kinds of guardrails, I think, are going to be better received by the broader public, is a good step to take, and is honestly safer as well. So I think that sort of combination of decriminalize all drugs and legalized, a kind of supervised, licensed guide is a good adjunct to the whole FDA campaign.
Mm-hmm. One of the things that I think is really interesting about everything that's happening with decriminalization, with legalization, and kind of the gray area and underground markets is that our firm has been really doing a lot of research into how fast the recreational space is growing. And there's so many dispensaries that are providing cannabis that are now beginning to illegally offer dried mushrooms, things like that. I was wondering if you had any thoughts on how can we even, when it's not in the policy, when it's kind of being done illegally and illicitly, how can we still introduce harm reduction kind of on a broad, more societal level to individuals who will be deciding to make purchases from these underground markets?
Yeah, the harm reduction stuff is super important. I know we're almost out of time too, but a good place to look is the Oakland resolution that decriminalized plants, basically psychedelic plants, includes a series of harm reduction statements. And it's kind of the obvious stuff, like don't go solo. If you're going to have a big psychedelic experience, be with someone who is able to serve as a sitter or guide, preferably somebody who kind of knows what they're doing, paying attention to set and setting, knowing something about quantities, like that kind of information. I guess to tie back to your what nonprofits are needed, we absolutely need that education to get out there, because whatever guardrails we might set up in a legal structure, people are going to do what people are going to do. They're going to find, I mean, even if dispensaries aren't selling dried mushrooms, you can just go find them in nature. I mean, there's no point in trying to stop people's access. And so, yes, the harm reduction education, I'm a big believer in that. And I guess we're out of time, so I'm not going to try to say what all that would involve, but I think, going to resources like MAPS and the Oakland steps are a good place to start. And I bet people can put into the chat some resources that they know too that are also good ones.
Mm-hmm. Well, Graham, thank you so much for joining us. We really appreciate your talk and insights.
Thanks for having me. Y'all take care. Bye-bye.
Yeah, talk soon.